Hello everyone and welcome to this video where today I'm going to be filming my 27-week pregnancy update. So as always, if you see me looking down, I have got my notebook here in front of me, and this week I'm going to cover my symptoms, my diabetic review, my antenatal class, breastfeeding masterclass and baby academy class as well. So I'll get started on a few symptoms that I've been experiencing. So I'm still getting lots of pain and stretching in my stomach. This is especially in the evenings and after I've had a larger meal. So towards the end of the day, I start to become really uncomfortable. With my stomach becoming much bigger now as well, I am starting to find that when I'm sat down, especially when I'm at my desk all day at work, that my stomach can really get in the way. It feels like it's really quite low down and that it kind of sits on top of my legs. So sometimes I kind of have to like sit with my legs to the side just so it can like relieve the pressure of having my belly there, as it really can feel like uncomfortable, like I'm holding it up by my legs all day. And it feels like such a relief when I do move them out of the way or can stand up again. And yeah, I can just let my belly sit where it needs to sit. I have also had a little bit of back pain this week. So I had this quite a lot towards the middle part of my pregnancy. I would be lying down in the evenings in bed and my back would really ache, but by the time I woke up in the morning, that would have gone. It seemed to have got better for a few weeks, but I have had it a little bit again on and off for a few days, so we'll see if that is because maybe I've had a more busy day or whether that's starting to return again now. A couple more returning symptoms I've had is constipation. This can be on and off throughout the week. Some weeks I'm fine, some weeks I notice it a little bit more, and this has been one of those weeks where I've noticed it a little bit more. I have also had a few headaches here and there as well, not really bad ones, just the odd one. And again, some weeks I can go and have no headaches, and then some weeks I'll have a couple. This could be due to different factors, like it could be like a hormonal thing for me, or it could just be more like I've gone to bed later and then that gives me a headache. So we'll just see how that carries on. I have started to be able to feel body parts on the outside a bit more, which is funny now because originally it started off with just like the odd jab here and there, like a little flutter, which then developed into like kind of a rolling feeling as I could feel baby moving around. But now I can actually feel where they're kicking. Like I could feel like maybe like a foot or a knee sticking out, and then when I tend to touch it, it moves back in again. But yeah, I've started to be able to feel like distinctive parts at this point now from the outside. Another thing that I've had really bad this week is baby brain. I am so forgetful still. I'm forgetting everyone's names. I'll be in the middle of doing a task and I'll just completely forget what I'm doing. I'll just pause for a minute and it takes me a few seconds to remember what I'm doing. Yeah, I didn't really have this the first time round, but it seems to have really been a problem throughout this pregnancy. Nothing major, it's just a little bit inconvenient sometimes, but it's more something funny that I can have a laugh about. So that was it for updates of symptoms this week. So I'll go ahead now and talk through everything that happened at my gestational diabetes review appointment. This time it was just the diabetic specialist nurse in there and the diabetic nutritionalist as well. So the first thing they did was check through all my readings, which they were all in target this time, so they're really happy with my readings. The nutritionalist then went through my diet. She did say that I am on the kind of bare minimum carbs that they would want me to be in pregnancy. So just to make sure that I'm not cutting back on any more carbs, and if there's places where I can increase them, then to increase them. For instance, for lunch I always have I have like a few snacky bits, but I'll have a low carb ham wrap, but she's mentioned because they're so low carb, try and increase them to like having 2 wraps with lunch. Personally, I don't know that I'm that hungry to be able to do that, but I'll see if there's another carb that I could maybe put in with my lunch to kind of up my carbs a little bit. I'll probably end up doing the same with my evening meals, as that tends to be the one where I think, oh, better not have too much carbs, so I could probably increase them. She did get me to have a look at this picture book with some portion sizes of like rice, for instance. There was lots of pictures and she kind of just got me to point which one that I would normally go for, but she said again I could probably have a little bit more than that. So I'll bear that in mind when I'm doing my meals this week. She then did just say she wanted to weigh me before I left, just because of having little carbs throughout this pregnancy. She just wanted to make sure that I'm gaining enough weight. So I think I've gained 2 kg so far, which is kind of on the lower side of things, so hence them wanting me to really start to increase my carbs, as I was in a healthy BMI before. They don't want me to start losing weight or not gaining enough weight. So yeah, they're really happy with my readings though, but they're actually said the opposite this time. Now I'm on metformin, that I can start to increase my carbs a little bit whilst my body will tolerate it. So that was everything for my gestational diabetes review for this week. So I'm going to go on now and talk about my antenatal class. It was actually the last session this week. We finished all 5 weeks now, and this week was called Caring for Your Baby, and it was a practical led session. So this was a session, they had someone else, I think she's like a community nursery nurse, I think that was her title, but she said you'll often see her in the clinics and things like that. But yeah, when we got there was lots of dolls sat out all around the seats. We didn't actually have to use these at all through the sessions, but the lady running the session did have a doll that she used for demonstrations. So some of the things that they covered, showing you how to care for the baby, were nappy changing, bathing the baby, winding the baby, nail care, dressing the baby, safety around the home, such as ways you can keep baby safe, like corners and plug sockets and things like that. They did also touch upon pet safety and making sure you monitor the baby around any pets that you might have as well. They did touch a little bit upon safe sleep and the importance of that. They kind of just direct you to the Lullaby Trust, as they have loads of really useful information on there. They spoke about holding the baby and supporting the head, feeding the baby as well. Obviously they've touched on that in other weeks, but they just kind of recapped over a few things that they've already mentioned on previous weeks. They spoke about car seats, making sure you've got a car seat, because you don't, new car seats, sorry, because you don't know if they've been in an accident in the past, and also just making sure that's fitted and ready to go for when you get to the hospital, because you're obviously going to need a car seat to take the baby home in. They spoke about a few medical things as well, like what things to look out for, places that you might be able to take like a baby first aid course and things like that. I have done a baby first aid course in the past before. I was also paediatric level 3 trained in first aid until a few months ago, so I just need to actually update my first aid, but I've been a first aider in all my jobs for many years, but I just need to renew that, and I think we might also look at doing a paediatric baby first aid course as well, just to be safe, because you never know. So that was all that they really covered in the last session. When it was the end, they didn't mention about anybody kind of staying in contact or anything, or any reunion sessions, and nobody actually did swap numbers. Everyone kind of just started drifting out a little bit, which was a little bit disappointing, because that was one of my hopes, and I know it was other people's hopes from the session as well, to be able to make friends at these sessions, because it's really nice to kind of meet up with people who have a baby around the same age as you. You give each other little updates and tips. I know that was really lovely when I had my daughter, and we're all still in contact now, and that was 10 years ago. So it was a little bit unfortunate that nobody stayed in contact, but I'm sure once baby is here that I'll go along to other baby groups and hopefully meet some new parents that way instead. So that was everything for the last antenatal class. This week we did also attend a breastfeeding masterclass at a hospital near us. So this was just like an extra session that was recommended by the midwife. I wouldn't say you necessarily need to do it if you've done the baby academy feeding class or an antenatal breastfeeding class. However, because we were free in the evening, we thought we might as well book it and get as much information as possible, so we're the most prepared that we can be. So this was an 1.5 hour long session, and this was run by 2 feeding experts from the hospital. So some of the things that they covered were skin to skin and the benefits of this, and how to encourage baby to feed pretty much as soon as they are born, and the ways that you can do this to help encourage them, and also the importance of this. They spoke about how important it is to feed the baby within the first 2 hours of being born. They did touch upon how some births it might be more difficult if you've had a C-section, actually physically holding the baby, and they might be a little bit more shocked as they've not been prepared for the birth as much, but also just the importance of skin to skin. Even if they can't feed, it'll help encourage it. They covered lots of other topics that have been covered in other sessions that we've attended, such as feeding positions, how feeding actually works, the latch, how to encourage natural feeding when first born, which we've already spoken about. They did also mention about vitamin D, which is something that I haven't looked into it too much, that side of things with feeding. However, that was really useful to know that that's something that we need to do. With formula fed babies, they actually make sure there's like enough vitamin D in the formula, but breastfed babies don't necessarily get as much vitamin D because we're not exposed to the sun so much in this country. So actually supplementing breastfed babies with vitamin D is really recommended, so that's something that we will take note and make sure that we do. They then spoke about different feeding cues, bonding with baby, hand expressing, safe sleep, as they often mention about if you're breastfeeding you can feel tired, have baby in the bed, and it's really easy to fall asleep. So just the importance and ways to do that safely. And they also directed us to the Lullaby Trust again, and how to know if your baby is getting enough milk. So that's all to do with nappies, making sure there's enough wet nappies in the first few days and beyond, but that's something that they've touched upon in the other sessions too. It was a really useful session. It was kind of done through PowerPoint slides, but at the end there was the opportunity to ask any questions that you wanted to as well. So if your local hospital offers that, I really recommend you go and do it, because the feeding specialists are really knowledgeable, probably the best people to ask as well. They also gave you some contact information if you are struggling with breastfeeding, and where to go and who to go to in those first few days and weeks of when your baby's here. On the weekend we did also do another online baby academy class. So this was a perinatal mental health class, and this was around 2 hours long. It touched upon lots of different subjects surrounding mental health after you have baby. So I'll talk through some of the things that they covered in that session now. So they spoke about what is mental health to start with, just to introduce the session. They then went on how to recognise different types of mental health problems that you may come across. They spoke about the baby blues, which is really common in the first few days of having the baby. This is where you might feel suddenly really emotional. They often say it's around day 3 when your milk starts to come in, your hormones are changing, and that's really normal. The mental health starts to come in if this is longer lasting and lasts more than a few days. That's when you want to start considering maybe having other issues that they covered in the session. They then went on to talk through OCD, the different ways that this can present, such as compulsions, and different things that you might be able to spot if someone may be struggling with OCD. They then spoke about anxiety, which they said is really common after having the baby. So they did it in scales. So they did some mild, moderate and severe. And they spoke about ways that you could help to manage anxiety depending on what stage that you think you are. So they said things that could help were exercise, meditation, making sure you have the right support around you, mindfulness, and then if it starts to get into that more moderate severe, then you want to be looking at therapy, CBT, which is cognitive behavioural therapy, and things like that. They then went on to talk about depression, and they actually said that the single most common cause of becoming depressed can be lack of sleep, which we all know after having a baby. You don't really get very much sleep, or just nowhere near as much as what you're used to. So they said some of the ways that you can tell if you're starting to feel depressed is that you're feeling more sad, you might feel guilty, anxious, which obviously has a lot of crossovers with the anxiety section as well. You might have problems with concentration, you might feel angry and irritated. You may also have physical symptoms as it puts like a lot of strain and stress on your body. You might have loss of interest of things that you used to enjoy. You might feel worthless, like you're a bad parent, like you're paralysed, that you can't retain certain information like you used to, and you might have sleeping and eating changes as well. So yeah, that was kind of all the topics that they covered. They did speak a little bit about psychosis and things like that. They said they're not as common, but they are really serious, but you'd probably be much more aware if those were going on if you're surrounded by people. But yeah, I think it was a really useful session. Obviously they send through all the slides which have the information to keep, so able to look back on those at any point if you need to as well. I really recommend you attend the session with your partner or significant other, because sometimes these symptoms aren't things that you'd notice in yourself. However, someone who's close around you probably might notice these changes, so that would be really useful if you could have someone attend that session with you. But as always, Baby Academy class was full of really useful information, and really recommend doing them as they are a free online class. And finally, I thought I'd just mention something that I picked up for baby this week. So we've actually picked up our baby monitor. I've decided to go with a VTech one in the end. It took me a while to look into reviews. We kind of knew that we wanted to go with a VTech one. However, there were so many different makes and models. We wasn't quite sure which one we wanted to get, but we decided to go with a non-Wi-Fi model, as we felt that would probably be the safest for us, and also one where you actually physically get the monitor and the camera also moves around the room. I am planning on doing a video showing everything that we've picked up for baby at some point. I'm not going to do that yet because we are still picking up bits here and there, but I'll definitely try and do a sit down video showing everything that we've picked up for baby at some point. But yeah, with this monitor, I actually wanted to order it from Boots as well, as I've been using the Boots recycling scheme. So if you collect kind of 5 empty products and you spend £10, you can recycle them at Boots. If you've spent £10, then you get £5 extra worth of points back. So we've been doing that for a few months now. They also do the same with pill packets. If you trade in 5 of those, you get £1 worth of points. So I've been collecting lots of points. We bought our nursery furniture off Boots, so we got a lot of points from that. So with doing that, we've actually completely got our baby monitor for free, which is amazing. I have still got some points left over as well, so I think we're going to just save up a few more so we're able to get our sterilizer as well. So it's nice to be able to use the reward scheme to be able to get a few free bits for baby along the way too. So that's everything for updates for this week. So I'll go ahead now and show you the bump update at 27 weeks pregnant. So this is the bump update at 27 weeks and 6 days. So that's everything for my 27-week pregnancy update. Thank you so much for watching, and I'll see you again next week. Goodbye.